Presentation. Today we're going to hear from Beverly Brockington about WIC in South Carolina. We're so grateful for your time this morning, Beverly. And just a little reminder of the flow of today's meeting. So first we're going to hear from Lori. She's going to give us a reminder of where we've been and how we got to today, hearing from Beverly and to the think tank presentations. And then we will turn it over to Beverly and she will give her presentation. And then when she is done, we will take some time to discuss what we've heard, brainstorm a little bit about some of the connections we've made, and that will be it. So thank you for your time this morning. And Lori, if you're ready, you can go ahead and get started.
Yes, good morning, everybody. I'm going to start sharing my screen and get through my part so we can get to the important good stuff. Kelsey, can you give me a thumbs up? All right, so welcome to our second think tank presentation. It's been a long journey to get here and we are so excited to start this Monday off with WIC and all the good things they're doing. Just a reminder of why we're here is that this is the opportunity. Kelsey and Landon and I have heard, we've been busting it trying to meet with everybody and hear everybody's story and all of this, but this is the first opportunity for the whole Healthy Palmetto Leadership Council to hear directly from the state leaders who are working on our identified priorities. And we're going to get a chance to discuss how our leadership council can help to advance these initiatives this year. So just a reminder of how we got to this point. Of course, we're all aware of our state health improvement plan that goes from 2018 to 2023. And within that, one of the 5 priority areas is chronic health conditions, that we really need to put some energy and effort in South Carolina on chronic health conditions in our state. And so in the state health improvement plan, goals and objectives are already outlined for us. And so Healthy Palmetto is the state coalition of organizations that's really focused on the healthy eating, active living, and healthy weight portions of our state health improvement plan. And so our purpose is to unify and mobilize healthy eating and active living efforts that create equitable opportunities for all South Carolinians to achieve a healthy weight. So again, we're not an implementing body. We're here to try to connect the dots and unify and mobilize. The objective that our work closely aligns with in the state health improvement plan is to decrease adult obesity rates, and we're trying to get down to 31.5%. And so as a leadership council, we monitor the data that comes out, and the latest data came out in September of 2021, showing us that we're currently at a rate of 36.2%. We also look at our unique data set, South Carolina Fitnessgram, measured data of our public school students to give us an indication of what's going on in youth, as well as that can be a predictor for those adult obesity rates later. We've been diving into the Trust for America's Health State of Obesity report. It comes out annually, but we've been looking at this for a past couple of years, really to look at what states should be doing to have a positive impact on obesity rates. And so there's a long list of things states should be doing. They all fall within one of these 6 categories. And we've been using the last few meetings to narrow that list down to a manageable amount that we can actually do something about and help to support to advance in our state. And so when we left the Leadership Council meeting in December, we had 13 priority areas. That was our narrowed down list. And since then, Kelsey and I have been meeting with each of these state leaders for each of those 13 recommendations, and 5 of them have decided not to go forward with us. We will go into more detail about how we got there, what the reasons were, all of that at our Leadership Council meeting on the 3rd of February. So be sure to be there for that. But the ones in white are the ones that remain. And so we've got everything from early care and education. We've got 1 in schools. We've got 2 in physical activity in the built environment. 1 remaining in healthcare systems, 1 in healthy food system. And then what we're going to be talking about today is to maximize participation of those eligible for WIC. So that's where our focus is today. And so this is our think tank presentation schedule. We had our trail development maintenance last Thursday. Today we've got 3 on our little schedule. So hopefully you can make all of those, with the first one up being WIC. Now we've got 2 more presentations on Wednesday of this week. So for today, Leadership Council members, this is your call to action, is to put on your Healthy Palmetto Leadership Council hat. If our role really is to unify and mobilize, really think about what they're presenting from that standpoint. Also, your organizational hat. From the very beginning of Healthy Palmetto, it was really not just you as your person, your position, but what can your organization contribute to this? And then, of course, we all sit on other committees and councils and coalitions and things like that. So don't leave out those roles that you play as well. And so after Beverly presents, we'll have 2 questions for you. So go ahead and be thinking about these. After she presents, what are you still curious about with WIC? And then what ideas did her presentation generate for you? So without further ado, I'm going to stop sharing and turn it over to Beverly Brockington, who's our Assistant WIC Director, to share her slides and tell us all about WIC.
Good morning, everyone. Okay, like Lori said, I'm Beverly Brockington, and this morning I'm here to talk to you about a program that has been around for 48 years. It is the Women, Infants, and Children Program, aka the WIC program. Now, the WIC program is a federally funded program administered by the United States Department of Agriculture, and its mission is to safeguard the health of low-income women, infants, children, up to age 5 who are at nutritional risk by providing nutritious foods to supplement diets, information on healthy eating, and referrals to healthcare. So those core functions of the WIC program is supplemental healthy foods, nutrition education, breastfeeding promotion and support, and referrals to health and community services. So who's eligible for the program? Pregnant women, breastfeeding women, postpartum women, children up to their 5th birthday, and infants. Other criteria for the program is a residential eligibility, income eligibility, and I just mentioned the categorical eligibility, and also a nutrition risk eligibility. Now, if a participant or potential participant is currently participating on the Medicaid program, or the Supplemental Nutrition Assistance Program, or the Temporary Assistance for Needy Families, TANF program, they are automatically income eligible for the WIC program. So it is regulated by the federal government, and we have to have 4 nutrition contacts with the participants a year. And it starts off with the WIC certification. Then at 3 months, we do the nutrition education, usually a class. And then we at 6 months, we have a WIC mid-certification. And then at 9 months, we'll do another class for nutrition education. Now, what we're doing at the certification, we're doing a really deep dive nutrition assessment. Okay, we're looking at weights, heights, hemoglobin. We're asking a lot of dietary questions, and we're trying to determine the nutrition risk eligibility for that participant. We're also determining whether or not we need to do referrals to health and other social services to meet additional needs. We want to determine what kind of nutrition education we need to provide and what kind of nutrition education materials to provide. And we also determine if this is a high-risk participant. They are classified as overweight or obese, and we need to make a referral to a registered dietitian for high-risk counseling. Breastfeeding, like I said earlier, is another core component, and we're really happy about our initiation rates increasing. So we're at 67.8% when it comes to breastfeeding. These participants get access to breastfeeding peer counselors, international board certified lactation consultants, as well as certified lactation counselors. So we're talking to them while they're pregnant, doing breastfeeding promotion, and then we're talking to them after they have the baby. We're providing them support and education. The program also supplies breast pumps for medical reasons. So if a baby is born prematurely and they're in the NICU, we'll provide a hospital-grade breast pump for that mom. And if they are returning to work or returning to school, we also have pumps available for them as well. And we also have breastfeeding supplies and classes that are available. So I just wanted to give you guys a snapshot of our breastfeeding rates. This is something that is monitored. And last year we did pretty good. We increased almost 1% when it comes to our breastfeeding rates. Typically, the WIC population does not breastfeed as much as the non-WIC population. And so we can get them to breastfeed, we increase the numbers for the entire breastfeeding community. So I mentioned earlier the healthy food package, okay, which is based on the dietary guidelines for Americans. We also take information from the American Academy of Pediatrics. The food package is low in fat, it is high in fiber, and it is meant to promote healthy weight for our participants. So we have our grains, and we have to make sure that there are whole grains available. And so they have the whole wheat tortillas and the soft corn tortillas and the brown rice and the whole grain breads. And we also allow whole grain pasta. We have our fruits and vegetables, which we call our cash value benefits, that allows the participants to purchase fresh fruits and vegetables, and also have the option of getting frozen and canned. We have our dairy options, which is usually milk, but they can substitute it for cheese, tofu, and yogurt. And in some cases, they can even have the option of 1 gallon of a low-fat chocolate milk. And then we have our protein options of beans, dry beans or canned beans, peanut butter, and eggs. So 48 years, okay, 48 years. So you know this program has been researched, okay, and everything is evidence-based. So the program has been shown to protect against obesity, improve dietary intake, improve health outcomes, improve birth outcomes. It reduces food insecurity and reduces healthcare and other costs, alleviates poverty, improves retail food environments, and support economic stability. These are all of the benefits of the WIC program. Now, one of the things Lori had mentioned the state of childhood obesity, and I looked at it for June 2021. And I also have the information about the percentage of WIC participants aged 2 to 4 with obesity. And the national rate had dropped from 15.9% to 14.4%. And the WIC participants in South Carolina is at 12.7%. So we're definitely well below the national rate of obesity in South Carolina. So we're really proud of that particular accomplishment. So where do we stand as it relates to participation? Okay, so we're around 86,000 participants a month. And we have our highs and lows throughout the year. And this is our racial and ethnic enrollment. And so we have a pretty good across the board participation. We are looking at trying to increase our contacts with the American Indian population. And so we're going to be looking at that in the future. But we're still only meeting about 44.1% of the WIC eligibles out there. Okay, so there's still about 56% WIC eligibles that are not participating on the WIC program. And if you break it down, we're serving about 40% of the estimated need when it comes to WIC, 40% for children. We do really great with infants at 90%, and we only do 20% when it comes to pregnant women. We have a lot of work to be done. There are a lot of potential folks out there that are eligible for the program that we can reach and give them this great information, this nutrition education, and this supplemental food package. So we have these barriers. So I get asked a lot, why are they not participating on the program? Okay, so there's that stigma with the WIC program. Some folks just don't want any assistance from, any kind of assistance when it comes to, helping their family. But there are misconceptions about eligibility. And then immigrants, they believe they cannot participate on this particular federal program. We have loss of time away from work. Okay, when you have you have to choose between being out for a doctor's appointment or coming in for the WIC program, you may opt not to attend a WIC appointment. We have some transportation and language barriers as well that we're trying to address. And then the shopping experience. So let's say you finally get the nerve up to go and get a WIC appointment, go through all that, giving us all your information, and then you go to the store and you have a bad experience at the store. So what are we trying to do to address some of those barriers? Where we're trying to maximize our technology. And so we're still very happy that we went to electronic benefits in 2019. So there's no more vouchers out there. Participants can shop without everybody knowing their business when they go into the store. They just swipe their card, enter in their PIN number. And if they want to check their benefits, we have our WIC Connect portal. They can check the benefits, they can change their PIN number, they can do all this stuff online. And when we roll out our EBT, we also have a mobile app that they have found very beneficial. And we had about over 80,000 downloads when it comes to the app. And with that app, they can check their appointments, they can check their benefit balance, they can scan foods, they can scan that UPC code to see if it's WIC eligible. They can check the nearest clinic, the nearest store. Very popular with the WIC program. We also have our online nutrition education. And so I mentioned that we have to have 4 contacts, and just 2 of those contacts are classes. Well, they can also opt to take a WICHealth.org lesson online. We have over 55 lessons available. Over 42,000 lessons were completed last year. Participants love the online classes, and they generally take more than the requirement for the program. They like to take it on the phone. 76% of them completed it on the phone. So we're trying to meet them where they are. And just FYI, they love the most popular lesson was Baby's First Cup. Another option for maximizing technology is remote services. So since the pandemic, we applied for some waivers, they were approved, and all of our services are conducted remotely right now. Clinics are not being asked to come into the clinic. Okay, so we are calling them on the phone, they're submitting all their proof via email. We're trying to meet them where they are, and they are taking advantage of us doing the remote services. I do want to let you know that clinics are open. Okay, so if there's a participant that has a need and they need to go to the clinic, that is still available to them. Okay, so we've been doing that for 2 years now. We have about 70 health departments and sites across the state. We also have a contract with 2 primary care centers. We have one in Beaufort with it called BJ Comprehensive Health Services, and then we have one in Horry County with Little River Medical Services. All right, so this is just a sidebar because in addition to all that nutrition education and supplemental foods and breastfeeding, we also have another program, and it's a summer program called the WIC Farmers Market Nutrition Program. It's a seasonal USDA grant program, and its 2 objectives was to really introduce participants to fresh fruits and vegetables that are locally grown and to support our local farmers. Last year, we had a decrease in the participation of the farmers market program, and we do believe it's because of the pandemic. But we also had some additional funds available through the American Rescue Plan Act, through the ARPA funds, that allow our participants to have $35 per month per participant during the summer. And so most likely they were going to the grocery store versus going to the farmer's market. But this year there's some revamping, revising, increasing the number of clinics that are issuing. And so hopefully we have an increased participation for our summer program this year. So collaboration, like I said, here's the key to success. We love our collaborative efforts. We have worked with First Steps. We have an agreement with them on a state level. And then we have each region, there's 4 regions in the state, and each region has a regional agreement with their regional First Steps. And so we're really working with First Steps, doing the same thing, increasing the participation and retention of participants on the program. We work with PASO, so we work with Lisbeth. We have worked with South Carolina Infant Mental Health Association, First Choice. Our breastfeeding coordinator just did a talk with the South Carolina Breastfeeding Coalition during their conference. We'll be giving a presentation in February with the birth outcome initiatives. We work with a Head Start and as well as local hospitals, just to name a few. And I have to mention the vendors, okay? We can't do anything without our vendors out there. So we have over 600 authorized vendors. And we're also trying to maximize technology with them as well. And so last year we were really happy to say that Walmart and Kroger has started allowing participants to use self-checkouts. And so they can go to the store and don't even have to go to the register and just have a seamless checkout process without anybody really knowing their business. And so we're hoping to bring on some additional stores this year that will allow us to do self-checkout. We're definitely looking at online shopping and curbside pickup. Okay, we have some states that are really doing a deep dive into online shopping, okay? Because it just is a little different. And so, but they know that it's needed, okay? So hopefully we'll see that in the near future with our vendors. And so this is just a position statement from the Academy of Nutrition Dietetics, and it came from this month's journal. And my Nutrition Services Unit Manager, Sylvia Davis, said, Beverly, you gotta make sure you mention this in your presentation. I said, okay, I'll put it in there. And she just wanted to let us know that, you know, the Academy of Nutrition Dietetics is all about prevention of pediatric overweight and obesity. That's what this position statement mentioned. The prevention of pediatric overweight and obesity, and it requires registered dietitians and nutritionists, okay? And who employs the most dietitians and nutritionists? It is DHEC and the WIC program, okay? So we can work with the prevention of overweight, obesity with our children and just kind of follow with the Academy of Nutrition and Dietetics position statement. So how can you guys help us? We just need for us to advocate for the program, okay? While you're out there working with your community leaders and community resources, tell them about the WIC program. Refer folks to the WIC program. It's been around for a long time, and it's been around for a long time for a reason, because they have shown that it works, okay? So we just need to kind of do some more outreach and get the word back out there. We have heard about the WIC program. I think it kind of got pushed back to the back. We need to bring it back to the forefront to show how beneficial this program is to those who participate. And if you want to refer to anyone, we have our appointment line. We have some referral information on our website. Everything is on the website if you need any additional information about the South Carolina WIC program. That's it. I'm done.
Thank you, Beverly. That was great.
Okay, let me stop video. No, not stop video. Let me stop sharing.
Should be like a little red rectangular bar that says stop share. There you go.
Thank you so much.
That was great information, Beverly. And I think it's encouraging. A lot of the data that we see around obesity is discouraging. So to see this little glimmer of hope in our state, that we've got some trending downward in the children ages 2 to 4. And we are so grateful for the WIC program in our state and for the work that you're doing in it. So thank you so much for that. Yes, hands clapping for sure. Okay, so would love to hear from the Leadership Council. Some of you, this was your first presentation. Some of you, this is your second. So let us know, what are you still curious about and what ideas did this generate? Either question, just tell me some of the things that have come to mind when you were listening to Beverly.
Can I say something?
Yes, please, Lisbeth.
First of all, I would like to say thank you so much, Ms. Beverly, for this wonderful presentation. It was very informative and complete. Even when I manage a lot of this information because I work side to side with you guys, I really appreciate it. Thank you so much. And we are very thankful for this partnership too. So thank you so much again.
And
Great
thank you.
presentation.
Meg, did you have your hand up? Were you trying to raise your hand?
Yes, because I couldn't find my electronic hand. So I just used my regular one. I'm curious to make certain of understanding the maybe the audience that you would like to focus the advocacy and the use, or is it a combination of the vendors or maybe the partners that you want to try to increase, or do you want to focus on the end user, which seems to be more beneficial based on your experience?
Really, we want to increase the participation. Okay, so we really need to make sure that we reach out to all those that are eligible, and so it really is the end user. Okay, and so we really want to partner, if we need to partner with whoever, we want to get out there, get into the community. So I'll be talking with our local regions, okay, our regional staff to say, hey, you need to get more mobile, you need to get out there. I could do so much from my standpoint, but we need to be seen on a local level as well. But we really want to reach participants.
Okay, then I have two questions that are sort of follow up with that then. Have you worked, or have any of the vendors been able to provide some assistance? I know like there's a lot of the WIC labeling in some of the groceries. I personally have noticed that at Kroger. And I think that would probably be one avenue, but is some of the information about how to participate actually even located at those vendor sites?
Not a lot, okay, because some of them are not really happy with the WIC labeling. Okay, some of them we have to really regulate and do a lot of monitoring, because some of them do not like to have all those WIC labels out there. But that is something that we could work on a little bit more with the vendors, is getting that information out there. But they are required to have the vendor labels on there, but there's not a lot of outreach information in those stores as it relates to the WIC program.
Okay, and then from a communication standpoint, do y'all do any type of targeted social media campaigns?
So we are allowed to use our agency Facebook and Twitter, but we cannot have our own WIC account. Okay, so we do pretty good. Okay, but we have to kind of get in line with everything that's going on with DHEC. Okay. And so that's something that we're always working at, but we really can't get down deep into with social media like we'd like to, like you have seen in some other states. Some other states are allowed to have WIC accounts, but we really have to go with whatever the agency is providing. And so we kind of get in line with their Facebook and whatever Twitter, any tweets that we put out there. But we have done some, but not a lot.
Do you know of any limitations then, say if another organization wanted to promote your program and actually maybe purchase ads on your behalf?
We can definitely explore that. We have mentioned that, definitely. Okay, we have worked with our National WIC Association as well. And I think First Steps have done some things for us as well. And so we have to start tapping into some other groups who have the ability to do their social media a little bit more fluidly than we can.
Okay.
Beverly, you mind if I join in and address some of this? First of all, I want to thank Beverly for her leadership. I'm the state WIC director. Beverly is my amazing assistant. I have the great fortune of coming up with all these great ideas, and Beverly actually puts it into action. So I'm thankful for her. She's an amazing leader and has done some amazing work with all central office staff and WIC staff across the state. South Carolina WIC is a member of the National WIC Association Recruitment and Retention Campaign. That is in digital and print. It's a small fee for us to join that. It's actually about, to be exact, about $150,000 for 3 years. And because we participate with all states and Indian tribal organizations across the nation, we get a great rate for the service. And so if you Google anything with breastfeeding, pregnancy, it's going to prompt you to our site, and then it'll take you to our website, and you can get all kind of information there. So we've joined that to help increase our participation. We mentioned the vendors. We have a vendor advisory group meeting where we meet with the corporate offices, and we have asked them to, get the word out that we want to increase our participation. Beverly shared some great facts as well in regards to how we work with our partners across the state. A great marketing strategy is word of mouth. So we want everyone to tell everyone about this amazing program. We want to collaborate with faith-based organizations. We want to collaborate with businesses. We want to collaborate with coalitions across the state. Really, this is going to take a team effort. And really what Beverly and team has done is really to maximize technology to improve service delivery. Now, she mentioned moms taking off work to come to the clinic. We transitioned to providing services remotely years ago to reduce the risk of COVID-19 to our WIC participants and to our WIC staff. So as far as technology is concerned, this program is positioned to meet the current and future need of our participants. And we've said for many years, if we build it, they will come. We built it. Now, in order to get them to come, we need your help. So that's what we're asking here. Just please tell everyone about this amazing program. The stigma, we have the debit card transitioning to eWIC. No one will ever know they're on this program. It is an amazing program that is a hand up, not a handout, that could really improve the health outcomes for our families in our great state.
Hi, I'm Sarah Wilcox. It was a great presentation. I was interested in the breastfeeding rates, and I had one quick question, but then just about the numbers, but then a more general question. So the around 20%, is that initiation or like maintaining breastfeeding?
Just maintaining.
Maintaining, okay. Okay.
Just a raw number of those who are classified as breastfeeding.
Yeah, and so do you think that those numbers, which isn't great that there's been an increase, but do you think a further increase is partly a function of just getting more of the pregnant women into the WIC program, or do you think it's something unique about breastfeeding, or a little bit of both?
I want to say it's a little bit of both, but it's definitely, as you can see, 20% of our participants, so they're not getting any of those prenatal contacts that we supply through our breastfeeding peer counselors. And then, of course, then we're also a program that issues formula, right? Okay, and so that plays a part. So we really have to make sure we're really pushing breastfeeding, but we got to get those prenatals onto the program so we can get them that nutrition education. So hopefully they'll make a decision and feel better about breastfeeding. And then we got to provide that support if they are breastfeeding at that time. So yeah, it's a dual thing that we need to do.
We have a question in the chat too, Kelsey. You want me to read it while I got it pulled up?
Yeah.
So it is from Brittany Sanderson. Welcome, Brittany. I don't know that we've had you on here before, but Brittany's with IMPH, and she's curious about what policies would need to be implemented to allow participants to utilize their WIC benefits virtually at online grocery stores or apps like Instacart.
Can I take that one, Beverly?
Okay.
So online shopping, that is coming soon. Beverly mentioned earlier that, WIC participants can now do self-checkout at Walmart and Kroger. That's new. The online shopping is coming. I just finished my term as the chair of the National WIC Association, and that is a big topic of discussion right now, allowing WIC participants to shop online, meaning they will be able to go online, just, shop, and then, swing by the store brings the food out and drop it in their car. That's coming. We're not there yet. We have to work with our vendors. It's going to be a cost associated with that. The vendor advisory group meeting, their position is like, hey, it's going to cost. What's the value to me? And at the national level, we're trying to work with USDA and get grant funding to do those type of things to really enhance those standardized systems here within the state to allow the online. SNAP already does it, so it's not a big lift to allow WIC participants to do that. One thing that we're working on is Beverly mentioned that the WIC program has been around for some time. Some of our regulatory requirements, and that talks about policies, procedures need to be updated. When COVID hit, we got permission to waive the physical presence and other things that were regulatory required within the program. We want to maintain this flexibility even after COVID, because we're trying to meet our participants where they are, and where they are is on their smart device. Many people are shopping online. And so that's the last technology piece on the vendor side that we need to do, and it's coming soon. So the policy procedures, USDA, the National WIC Association, I'm still serving on the board of directors as its chair emeritus. That is a topic, a priority topic for us right now, is really getting that online shopping for our WIC participants. And I'm confident that it's coming soon. Did that answer your question, Brittany?
Yeah, she clapped. I have a question. So I'm looking around who's here from Leadership Council today, and a lot of very evident ways that each of our organizations, I think in most cases, I mean, Elizabeth spoke up, HASA is already working hand in hand with WIC. Jeremy, from a nutrition standpoint, I'm sure you part of most of the people in WIC are on your on your different boards and things like that. So looking at it from like a Darlene standpoint, a Zach standpoint, somewhat, Kelsey and Meg, and like these local coalitions are out there, would there be benefit if the target of who we're trying to promote WIC to would be like pregnant women or women who are, childbearing age? As these local coalitions are trying to decide what they do to address food access in their local communities, would there be a benefit, or do you see any issues with those of us that are working with local coalitions to promote WIC that way? So, prompting these local coalitions to say, well, have you worked with your local WIC office? Do they need help promoting WIC? Because that seems like if the local programs are thriving, that then helps the greater community, because you've got more people that are benefiting from the services that WIC provides. Does that make sense? Is there any issues with that, or do y'all see that could be possibly a benefit? We just want to stay away from that. What does silence mean? y'all gotta communicate. I don't know what silence means. Beverly or Barry, do y'all see a problem with connecting these local coalitions to your local WIC offices to see how they can help?
I mean, that is something that we are actually pushing this year. And so like with First Steps, it's always been done at the state level. But I'm really pushing out the WIC program manager at the regional level to work with their regional coalitions and community resources to get that word out. When
Yeah,
I've gone to some state level meetings, I've been told I don't know about this. No one's participating on our local regional coalition. No one's participating. So we are definitely trying to push the regional folks to get out there into their community.
so Beverly, she's spot on. This definitely can be value added. Collaboration is the key to success. We cannot do this alone. We need everyone working together to reduce our obesity rates and really improve the health outcomes for our great citizens. The regional program managers, Beverly and I at the central office, we're at the state office, and we have oversight over the entire program. We have 4 regions across the state, and those regions have a WIC program manager. And so we've asked our regional program managers to really focus on collaborations, memorandums of agreement with hospitals within that region, because that's where the babies are being born at, right? That's where the moms are. So let's, develop a memorandum of agreement, memorandum of understanding. Within DHEC, a letter of agreement is much easier, some type of agreement where we're going to work with these local partners to really get the word out about this amazing program. So I think that would be super value added, Lori, and I really appreciate you bringing that up.
Yeah, it definitely sounds like a great opportunity. What about you, Jeremy?
Yeah, so I'm just kind of writing notes, and I've got a couple of comments and a couple of questions. First of all, Beverly, awesome job, and really appreciate you presenting that good summary and representing all the great stuff that dietitians do across the state. So, I know y'all do some of the best work here with women and children. And so I guess a couple of comments. One is, when you're talking about the stigma, so I'm just going to confess on my own ignorance. I thought the cards were coming, but I didn't know they were out. And so if I, as a professional, am behind the times on this, I think there's probably a ton of potential recipients who are. And I can tell you, because I run a private practice, that's my main job. And I can tell you that that's at least number 2, if not number 1 reason why there's people who turn this down. More than kind of refusing help, they just hated the historical struggle of the WIC even more than SNAP, like the having to do the vouchers and all the crazy stuff. And so just knowing that that's now the case, and that not only can they use cards, but now we have self-checkout, removes such a huge barrier that should be one of the big pieces of messaging. And I know on my part, that's going to be something I'll be telling my clients as we go forward. So I'm excited about that. I think that's huge. And I think to Barry's point, which is really cool, the fact that SNAP is already being implemented online, and I noticed like Amazon rolled it out last year, which is huge. I mean, I can't even tell you how huge that is. If WIC follows suit and is available online for those things, and like Walmart online shopping or whatever, again, huge step forward for people who either can't get to the store or don't want to, or B, have transportation issues. I mean, the idea of being able to shop for healthy food and ship it to your house, that's a massive leap forward in a rural state where we got transportation issues. So all these things are big keys. And I think one of my questions is, which I'm sure you have this as a professional, is there like a 1 or 2 page slip paper that I can like hand to people in my office? And if so, I'd love for you to, send those my way. I can get your contact information and send those my way. The other, I'm excited to hear about the telehealth part of it, because again, that education part, I've been doing tons of that the last 2 years of my own practice. So that's going to continue to be a big piece of how we make this successful. And then my other question is, as a referral, as a dietitian, can I refer somebody to the program, or does it have to be a doctor? How does that work?
So we refer within the program. We don't take, but the doctor can refer someone to participate on the program. Is that
Okay.
what you said, Jeremy?
Yeah, like if I, yeah, can I do that, or only a doctor can refer that participation?
No, you can refer. If you find
Okay.
somebody, you can go ahead and get that information, whatever information you have, by all means, refer them to the program.
Okay, perfect, awesome. All right, good. And then my last question, and this is not a question I think we can answer, but it's just an observation because I've talked to several states, and this is I think a nationwide issue. When they rolled out the fruit and vegetable voucher waiver, whatever, for the fresh fruits and vegetables, that was a huge shift in 2006, whenever that was, and that was a big benefit. But I'm looking at that number now, $9. And with the way food prices have gone up, that hardly buys enough for one person for a week.
Absolutely.
And it's like just scratching the surface. And I guess I'm wondering, is there work being done to shift that percentage, and what can be done on that front? Because if we're talking about healthy outcomes, as a dietitian, we know that moving more towards those foods improves health. And so like what's sort of going on with that area?
So let me just let you know, just right now, we are currently operating under a temporary solution. Okay, so currently participants are receiving $24 for children, $43 for pregnant and postpartum women, and $47 for fully and partially breastfeeding women. That was what was recommended by the National WIC Association, and it's temporarily because there were some funds available. So we had to do a temporary increase nationwide for the CVB. And what the hope is, it's already been extended for another 3 months. The hope is that it will become just standard practice, and it will become part of the regulation, that we can keep the increase of the CVB to what it is that we're doing temporarily. Because yes, $9 is not enough. And so right now we're operating with $24, $43, and $47 for our participants right now.
Okay, fantastic. That makes me feel a lot better, because I was, that just, you talk about a difference. I have 6 kids. I can tell you that my budget for fruits and vegetables is a lot higher than that. So, so it's good to hear that.
Yeah, Jeremy, you asked some great questions, my friend. And Beverly shared the cash value benefits was actually part of our legislative agenda that we provided to the Biden transition team, was to increase the National WIC Association plan, was to increase the fruits and vegetables for WIC participants. And then, as Beverly shared, that was approved. WIC participants are now getting double, sometimes triple the amount that they were previously getting for fresh fruits and vegetables. And, we are really pushing hard to make that a permanent solution. Beverly shared that it was temporary. We are pushing hard to make that a permanent solution. Jeremy, you also talked about, people not knowing that we had transitioned to EWIC. We did a huge media campaign to try to get the word out across the state that we had transitioned to EWIC, and that, we also have a cool app where participants can actually go on their smart device and scan a food item to determine whether it's WIC approved or not. So when they got up to the point of sale, they could hold their head high and be confident that they're not going to have a situation occur at the point of sale or the cash register. So that has been amazing. So that app that we have, that they could scan that food item, and they know it's WIC approved, and they can get up to the point of sale and just purchase it, no problem. So those are the things that we're looking at, Jeremy. And I traveled the state, Beverly and I, we try to get out and we try to talk to participants, and they tell us that, hey, these are some concerns. And everything that they have shared with us, I can assure you, we have addressed it from a central office perspective in regarding to technology. Breastfeeding, we talked about breastfeeding earlier. We've increased the amount of peer counselors that we have across the state. We used to have an FTE position, and as those FTEs transitioned off, we brought in hourly staff, and we could get 2 peer counselors for what we were paying for 1 peer counselor. Beverly also did a tier program where we could have a senior person there that has supervisory ability over those individuals there. So we're really putting a lot of resources in the area of breastfeeding. And so really appreciate all your comments, Jeremy. They were spot on, and we're really looking to address everything that you said. I think we got a good plan in place.
Yeah, that's awesome. Thank you all. This is good. It's exciting to hear.
Okay, so it looks like we have a question in the chat, and Cherie, I see your hand raised as well. And we've got 9 minutes left. So I'm going to go to the chat and then I'll come to you, Cherie. So the question in the chat from Casey is, do you have a good working relationships with home visiting programs like the Nurse Family Partnership, and are they a good referral resource?
Yes, ma'am. We definitely work with the Nurse Family Partnership, the ones that are participating in the regions, and we do refer to them, and we work together with the Nurse Family Partnership.
Awesome, thank you. And Cherie, go ahead.
So WIC is close to my heart. DHEC is my old stomping ground. WIC kept me busy while I was there, and now I'm with AARP. And I think we probably have the least obvious connection to WIC, but you know, we serve the 50 plus and their families, protect the rights of the 50 plus and their families. Our goal is to make sure people can choose how they live as they age. And we focus a lot on food security. We promote SNAP all the time. And we have a lot of grandparents who are concerned about the health and well-being of their grandchildren. And we saw during the pandemic just how influential grandparents can be down the lineage, influencing people to get vaccines and things like that. So it just has me thinking about how I can integrate this into our food security work and promote this, because we've got over 600,000 members across the state. And in addition to being grandparents, they're also community leaders and advocates. So they care about this kind of stuff and they spread the word in their communities. So I'm just reconnecting with WIC and thinking about how I can, you know, use the network that we have.
It's funny that you mentioned that, Cherie, because we are developing a grandparent brochure to feature on our website to target grandparents because they are taking care, a lot of them are taking care of their grandchildren. So we are doing a special promotion and outreach to grandparents. So you should be seeing something soon on our website.
Perfect. I'll be checking for it. Good.
I
Yeah,
love how
sure.
everybody made connections. Like I was thinking that, Cherie, but I was like, when you said it, it's so clear, right? It's so clear that the people that you reach, and just thinking about every member on Leadership Council, that's exactly what Kelsey and I hoped y'all would do. Yes, we collectively want to help each of these groups of state leaders that are doing great work in our state, but we also wear organizational hats too, right? And so thinking about it from that standpoint is exactly what we hope will happen on these calls. So thank y'all for chiming in. Jeremy, you did a great job too, like just really making it tangible, something very tangible that can go forward this year to help advance WIC and all the great work that they're doing.
Hey, Lori, real quick. Hey, it's great to see you, Cherie. Listen, she actually was instrumental in getting us approval, because she used to be part of DHEC's communication team, to get approval for us to join the National WIC Association Recruitment and Retention Campaign. So very much in debt to you, my friend. And, you know, grandparents, like you said, could serve as a proxy. I mean, grandparents are doing some amazing things with many of their grandchildren across the state. And so, yeah, that's a great opportunity for us to connect with. So thank you for highlighting that.
All right, well, thank you all so much. This has been really encouraging just to hear the ideas generated and just the light bulbs going off. This is, like Lori said, exactly what we hoped. So thank you all so much for your time today. We have our next one in 5 minutes. So I'm gonna go ahead and wrap it up so everyone has a minute to stand up and do what you need to do before we come back at 11. But just a reminder, So we will continue discussion around each of the think tank presentations on February 3rd. So if anything came to your mind during this presentation or the last one or the next one or the next one, please take note of that if you didn't get to say it out loud, and we'll continue to discuss it on February 3rd. So thank you guys so much, Beverly, Barry, just really appreciate your time this morning, and we will see you all in 4 minutes.
And Kelsey, are we in the same Zoom room?
It's a different link. So you'll go to
Okay.
the calendar invite
so
on your calendar.
Just making sure we actually need to leave or not.
Yeah, so go ahead and
Okay.
log off and log back on.